Hi, my name is Laurie Dean. I'm doing my video presentation on Canada's healthcare system for Elizabethtown College. First, I'm going to talk about the main parts of Canada's healthcare system. The organization of the healthcare system is determined by the Canadian Constitution. The roles and responsibility are divided between the federal government and the provinces and territories. Canada has both private and public health insurance plans, and they're funded through both taxpayer funding and federal taxation through the Canada Health Transfer. Federal funding is available if the provinces and territories meet national standards in the Canada Health Act. There are four main parts of Canada's healthcare system. I'm going to talk about financing, publicly funded healthcare system, the Canada Healthcare Act of 1984, and private health insurance. First, I'm going to talk about financing of Canada's healthcare system. The provincial level, it's taxpayer funded. Some of the examples are income taxes, payroll taxes, and state taxes. That's how Canada gets its financing at the province level and the territory level. Federal level funding comes through federal income taxation through the Canada Health Transfer. The Canada Health Transfer is the money that the government sends to each province and territory to help pay for health care. Provinces and territories must meet the national standards to receive the full amount of the available federal funding to pay for their residents' health care costs. Next, I'm going to talk about the publicly funded healthcare system. In Canada, this is known as Medicare. There are 13 health insurance plans. Each province and territory has its own plan. There are 10 provinces and 3 territories in Canada. All Canadian residents have equal access to medically necessary health care services. All residents are guaranteed coverage for these services. These include hospital, diagnostic, and publicly insured physician services. These are all covered services with no out-of-pocket expense cost to residents or patients. The next main part of Canada's healthcare system that I'm going to talk about is the Canada Health Act of 1984. The 5 main principles of this act are public administration, portability, universality, comprehensiveness, and accessibility. Next, I'm going to explain a little bit about each one of these. Public administration, the plans must be operated and administered on a nonprofit basis by public authority. Portability means health insurance must be portable from one province or territory to another. So if a resident moves from one province or territory, they can have access to a health insurance plan or take their plan with them to that territory or province. Universality, all Canadian residents must be covered by health insurance. Comprehensiveness means medically necessary services such as hospital and doctor services are covered with no out-of-pocket cost to residents. Accessibility, all insured residents should have reasonable access to health care services. Because the Canada Health Act of 1984 is such an important part of Canada's healthcare system, I'd like to touch on a couple other items. The Act stipulates that all provinces and territories must provide insurance for Canadian residents for medically necessary healthcare services. Some provinces and territories may receive additional benefits for other healthcare services such as dental, vision, chiropractic care, prescription drug coverage or benefits, and home health care, rehabilitation services, items like that. In order for each province and territory to receive full federal funding, they must meet the national standards and guidelines that are set forth by the Canada Health Act in order to receive that federal funding. One other item to mention is that while most physicians work in for-profit private practices, they bill and are paid through the public insurance systems on a fee-for-service basis through each province and territory. Next, I want to talk about Canada's private health insurance. This is used for services not covered by Canada's public health insurance plans. For example, some of the items that I mentioned before, such as the dental and vision care, rehabilitation services, prescription medications, home health services, and one other item that I wouldn't have thought of, which was the private room for a hospital stay. Many Canadians have private health insurance to assist with these cost-sharing services, to help assist to cover items that aren't covered by their public health insurance. About actually 2/3 of Canadian residents actually have private health insurance to supplement their public health insurance. Coverage is obtained through employers, unions, and other organizations. And again, like I mentioned before, most physicians work for private practices, but they're paid through public insurance plans in each of their provinces or territories. The next part of the presentation is going to focus on the history of Canada's healthcare system. Under the Constitution Act of 1867, the provinces maintained and managed hospitals, asylums, charitable institutions, and other charities, while the federal government was responsible for marine hospitals and quarantine. The province of Saskatchewan was the first province to offer a public universal hospital care plan in 1947. Other provinces and territories followed soon after. The federal government became involved and passed the Hospital Insurance and Diagnostic Services Act of 1957, which provided cost sharing for provinces and reimbursement of 50% for medical services for hospital and diagnostic services. To continue to talk about the history of Canada's healthcare system, by 1961, all provinces and territories paid for inpatient and diagnostic healthcare services by public funds. In 1966, the federal government passed the Medical Care Act. Under this act, there was a 50% cost sharing that occurred between the federal government and the provinces and territories for doctors and hospital services. By 1972, all provinces and territories had universal physician health insurance plans, and then in 1984, the Canada Health Act was passed. This legislature replaced all previous federal hospital and medical acts, and this is still in effect today. And that's why we spent a lot of time on that previously, because it is still a big part of Canada's healthcare system. The next part of the presentation is going to focus on Canada's healthcare policy key stakeholders. The key stakeholders are the federal government, the Federal Department of Health, the provincial governments they administer the health insurance plans, Health Canada, the Physicians and Nurses Association, and the Canadian Medical Association, the industry and trade groups such as the pharmaceutical groups, and there are other ones that I'm not going to really touch base on, and the Canadian public. They're all key stakeholders in the Canadian healthcare policy. I did include the organization of the health system in Canada in this presentation. I'm not going to spend much time focusing on that, but I did think that I found it very useful to kind of see the breakdown, but in essence of time, I'm not going to really spend a lot of time on that, but hopefully you'll find it as beneficial as I did. Canada's healthcare policy, next I want to talk about a little bit who's in charge. The roles and responsibilities are divided between the federal government and provinces and territories, as I did mention previously. The Canadian government is composed of the Senate, the House of Commons, the Governor General, and the head of state, which is the King or Queen. They have the authority to review and accept healthcare legislation, which is known as bills. And before a bill can be passed into law, it must first be accepted by both the Senate and the House of Commons, and then it gets submitted to the Royal Assent, which in Canada is the Governor General, who acts on behalf of the Queen of England to pass a bill into law. Next, I'm going to focus on the major changes to Canada's healthcare system in the past 10 years. Some of the initiatives that they have put into place are e-health, such as using the electronic health record and telehealth. They're the main focal points to facilitate effective care coordination for their residents and patients. Another initiative that they're focusing on is wait time reductions. They're trying to reduce wait times to see specialists, and also to reduce the wait times for medically necessary services in the area. So in order to do that, they're hiring and training more healthcare professionals in order to improve access to care. Canada is also expanding ambulatory and community care programs to reduce wait times, and also to assist in the acute care services that they need to provide. Since they do have all their residents or receive healthcare insured services for physician services in hospitals, access and wait times are an issue, and they realize that, so they are, addressing these in some of these manners. Patient safety and quality care is another model that they're following to better serve the needs of the patients or their residents and reduce patient safety errors. And primary care, involving the shift to primary care health teams in an effort to move to a patient-centered medical home model for continuity of care. So in conclusion, Canada's healthcare system is financed by both the federal and provincial governments. All Canadian residents receive universal health insurance coverage for medically necessary services through public health insurance plans in their province or territory. These plans cover hospital and physician services. Residents can obtain private health insurance to assist with covering prescriptions, dental and vision care, chiropractic services, and more. And then in addition to that, there are 13 provinces and territories in Canada which are eligible to receive federal funding as long as they meet the national standards that are set forth in the Canada Health Act of 1984, which Canada still follows today. Canada's focus is on improving wait times, moving patients towards a patient-centered medical home approach, and utilizing and improving e-health technologies for patient care. These are the references that I use for this presentation. I'd like to thank you very much for your time, and I hope that you learned a little bit more about Canada's healthcare system, as I did. And I also, learned a lot about it and compared it a little bit to what we have today here in the U.S. Healthcare system today. Thanks again, and I hope that you enjoyed it.